In 2011, a friend of mine had her first baby through vaginal birth. Now, as is common with first vaginal birth, she had to be given a cord to ease the passage of her child. Then she was stitched up and sent home. That should have been the end of the story. But some days later, she noticed that she had started to stink. After about 2 weeks, she went back to the same hospital and they gave her antibiotics and malaria drugs. She went back home, she continued to stink. Then she did the usual Nigerian thing, hot water in a bucket, sit on it, add salt, add Dettol, but the smell persisted. After about a month, she went back to the same hospital and then she was referred for a HVS test. It was when the lab technician was about to take the HVS sample that she noticed that something was inside her vagina, when she was about to insert the speculum. So she quickly called the doctor to come take a look at my friend. And then when the doctor came, they noticed that a swab of cotton wool had been left in my friend's vagina. They had to use forceps to get it out. The whole room was a mess. Everybody fled that room. Now, what had happened was the doctor who had stitched her up after birth had to insert a swab of cotton wool deep inside her to stop the bleeding, to enable him stitch her up. And then he didn't tell her about it. She didn't know about it. The nurses didn't tell her about it and she went home with it. She carried it around for a month. She had to be admitted immediately, antibiotics intravenously. Now her situation could have gone south. The doctor said that if she had wasted another hour, probably septic shock or worse, infertility. My friend didn't sue. In fact, she even paid for her treatment in that same hospital. The doctor who was responsible never came around to say, "I'm sorry." The hospital management never apologized. She couldn't sue because she understood the Nigerian judiciary system. It's usually a waste of time. But every time she talks about that story, she wonders about that doctor who stitched her up in the first place. Was he ever told about it? Did he know and refuse to apologize to her? How many other women has he done that to? What did the hospital management do to that doctor? Hundreds of thousands of Nigerians have been victims of medical negligence, major or minor. Some have sought justice. Some are discouraged from seeking justice because of the judiciary system. But then most times when you seek for justice, it's not for your sake because it has already happened to you. It is to stop it from happening to the next person. My friend is lucky. She has 2 more kids now, so 3 in total, yeah. So nothing happened to her. But how about those who didn't survive? Today we're going to be talking about medical audit. My name is Ekwi Onyekwele. This is the White Coat Report. We'll be right back. Our topic for today is the role of medical audit in improving patient care. Our guest is Dr. Oputa Sylvester Chinedum. You're welcome, sir.
Thank you.
All right, sir, I know you are the former chairman of
Medical and Dental Consultants of Nigeria.
Yes, Association of
FMC
Nigeria,
Abuja
FMC Abuja
Yeah,
chapter, MDCAN.
MDCAN,
Yes,
yeah.
You're welcome.
Thank you.
Yeah, I'm sure you heard my story.
Yes, I heard your story.
Yeah, if you were to
Quite
talk,
touching.
yeah, quite touching. And if you were to speak to her, maybe at the time when it happened, what would have been your advice to her
Advice to her.
in terms of getting her case addressed?
Well, what happened is that, okay, after everything, she got good treatment and she left.
She paid for
went
it though. The hospital.
She has to pay for it. It doesn't matter. Complications can occur when a doctor is giving you treatment. It doesn't mean that when the complications occur that the doctor should pay for it.
But this is not complication. I would classify it as
it
negligence.
Where you might not say it's negligence. Okay? A doctor has performed something, maybe forgot cotton wool, or maybe he used that cotton wool. You know, when you're doing something, if you've not heard both sides of the story, you might never know what happened. So you might be hearing one side of the patient's story. Okay? So, however, something in the vagina, can easily be brought out. You understand? Even by the patient himself. If cotton wool is in the vagina.
It was deep in there. I think with time it started dropping. Yes, but she was uncomfortable, but she thought it was the stitches. Her first child, yeah.
So, however, medical audit generally is what we do in hospital. It's a continuous thing. From building the hospital itself, the structures, because we have what we call the physical structures of the hospital. We have the processes, okay? That is the technologies and the technologies used to give treatment. And then we have outcome. Outcome, when you want to look at it in the sense of patient satisfaction, cure gotten by the patient, okay? And then maybe complications that were lessened, because patients come to hospital with different types of diseases and severity. So you can have a diabetic presenting, is not no much complication. You can have another diabetic presenting with many complications. So if you see that diabetic, you give treatment, complications can be reduced. It might not disappear. Do you understand? Then blood sugar can be controlled. So it means you're doing something, okay? So audit in itself is done like daily, monthly, yearly by hospitals, okay? The doctor, there's what we call self-audit also. A particular doctor, you can always audit yourself. It's not, we are human beings. We learn, we study. There must be extent to which your knowledge, is, no matter who you are. Are you getting my point? So it's for you to look inwards. I don't know this. You study more to know it better. Okay? Now, you don't rule out the side of mistakes.
Yes.
We are human beings, we make mistakes. Okay, so if a doctor forgets cotton wool, well, it's not nice that a doctor
I think this is even
that.
just a minor. Let me know.
It's a minor one. Some
Yeah,
forget cotton wool even in the stomach.
Yes.
Okay, you remember sometimes maybe the doctor has been operating in the theater. I'm not like
You're not
giving
excuses,
but you can never know. That's why these things are multifactorial. The causes of the outcome the patient gets can be multifactorial. There's what we call the qualities of a good doctor. Is one, knowledgeability, affability. Affability means your attitude towards patients. Smiling to a patient, introducing yourself, making the patient feel at home, having common ground with the patient, like you are not forcing a patient to take drugs. So if you want to write drugs, you want to get the patient to know you are going to take this drug, okay? You agree, okay? You have to tell, some people have diabetes, they have to take their drugs for life. Is it easy? You have to be affable enough for patient to agree. You have a common ground, okay? And then availability of the doctor. So a doctor knowledgeable, affable, and what is it called? Available. He's a wonderful doctor. However, I want to say this thing is something that is said. One day when we were having a lecture, one of our professors enters and used the word and told us, we are wondering what does that mean?
That's you people will kill someone.
Yeah, you will kill someone. How? Why? We are here to study to
save lives.
To save lives. You understand? But he's saying that one day, you can just make a mistake and somebody is gone. Are you getting my point? And the thing is that you didn't intend to. Are you getting my point? There are certain times, the doctor is under a lot of pressure, I must tell you. However, the pressure, if you come to our hospital, where I told you that, what is it called? Audit is continuous. You remember we have
at this
registrars.
point, for the sake of our audience,
Yes.
Because we don't know if they understand what we mean by medical audit. So maybe you can tell them what medical audit is.
Yeah, everybody, once you say audit now, everybody understands what is audit.
But let's
like
give the benefit of the doubt.
Some people are coming to check your accounts to know whether you are doing well.
So when you're auditing,
so when you are doing medical audit, is the doctors themselves are auditing themselves. Are you getting my point? Too? There's what we call evidence-based medicine. What is evidence-based medicine? Evidence-based medicine is practicing with what we call, you practice based on best available evidence. You understand? We say we define evidence-based medicine simply as the use of judicious use of current best available evidence in the management of individual patients. Are you getting me? So it has to be explicit. You know what I mean by explicit use? Explicit means that this thing is based on clearly stated guidelines or what we call standard operating procedures.
Yes,
or
SOPs.
standard, yes, SOP. So every doctor practices what we call evidence-based medicine. We don't practice just from the air.
So are doctors in Nigeria audited? That's all we want to know.
Yes, that's what I'm telling you.
And how often are they
That's
audited?
why I'm telling you. It is a continuous process. Even FMC itself, like the hospital I come from, is being audited. The structures are being, that's why sometimes you have what we call people coming like accreditation teams.
Okay, so external audit.
Yes,
how about internally?
Internally, that's what I'm saying.
Okay.
The doctor himself, some of them are at the level of registrars, some of them are at the level of medical officers, some of them are at the level of senior registrars, some of them are at the level of consultants. Okay, so this is a line of audit. So we had a clinical conference today where they presented a mortality review where a patient came to the hospital and died. So we now presented it. Why do we want to present it? We want to know what happened. What were the far and near causes of death? Because a patient comes to the hospital and dies in the hospital doesn't mean that it's the hospital that caused the death.
Okay.
There can be other problems like cultural, religious, delays in getting to the hospital and that. Because my question after presenting the case today is, did the patient die in the hospital? The patient died, less than 48 hours of coming to the hospital. Do you understand? And they presented, they said, no, you can't present this kind of case because the cause of death wasn't from this hospital, probably from the delays the patient had. The patient went to a PSC where they didn't use evidence-based guidelines to deliver the woman.
Okay.
Because the woman was having obstructed labor. Instead of referring the woman early to the hospital for CS to be done, they kept on forcing the woman to deliver vaginally. So they were pushing what we call fundal pressure. It's an abomination. So they were pushing. And the woman had to deliver the baby by force, and the baby died. Instantly she was delivered. And ruptured the uterus. The woman ruptured the uterus. And then they carried the woman to this hospital, almost 3 hospitals before they got to FMC. In fact, if it wasn't for the medical director that said, okay, just do, don't collect money, do. They took the woman, went to the theater, removed the uterus because the uterus has been ruptured. And then the woman didn't even have money to access ICU. The medical director said, no, enter, take, no payment. And after everything, the woman, died because the woman needed dialysis because the woman has had acute kidney injury. So when they were taking the woman outside to go and do hemodialysis, the woman died on the way. So the question is the death going to be counted as part of our mortality in our hospital?
Okay. So let me ask you now, in all your years you're on the auditing team in your hospital?
No, I'm a consultant, so I'm part of the auditing team. Every doctor is part of the auditing team.
Okay, fine.
But
right.
there are special auditing teams
Exactly.
they keep that look into some of these things.
All right.
Okay.
So in all your years of participating in the auditing of your doctors, what happens when a doctor makes a grave mistake? Mistakes vary. A mistake can just cause minor harm to the patient. But what happens when it's a grave mistake? Which probably led to a loss of life. What do you now do to...
Great things happen when a doctor makes a mistake. It depends on the type of mistake.
Yeah, that's
you
what I'm
understand?
saying.
If it is a mistake that is based on negligence, you're going to go in for it. If it's a mistake that is based on...
Is it like disciplined under the hospital management rules, or is it reported to the council?
It depends. It depends on the patient grievances. There's a patient that something will happen and the patient won't take it up. Are you getting my point? It doesn't mean we'll now take it up to the council because we have tribunals that can be set for doctors for negligence and they will go in for it. Take out their code, they won't practice again, take their certificates and they won't practice. They will be I will use the word decoded. They will be removed. They can't practice medicine. It has happened to several doctors. Do you understand? So those things are there. If I come here and steal probably this camera, if you don't take me to court, Nobody's going to
Okay, so that
talk.
means the patient would have to lay a complaint.
Simple. The
So
patient lays complaint, and that's why we have complaint. If you
Okay.
check our house, we have complaints. Because we want to look into patients' complaints too. In fact, there are officers that are appointed to look into patients' complaints and make sure that the patient gets justice. Do you understand? And they are satisfied, because if a patient complains and you don't take action, the patient won't be satisfied, and we want the patient to be satisfied. So if the patient complains, you must take that complaint to the highest level.
So how do we eliminate bias in the system if you're being audited by your fellow doctors?
You see, first of all, the hospital have their disciplinary committee.
Yes.
Okay, first of all, because first of all, we are all brothers. We want to look into what caused your mistake or patient sad outcome. Do you understand? First of all. Now, when we look into those things, you get your adequate punishment as stipulated by law, as per based on what the hospital can do to you. They can give you extension, they can, take your salary for a month, they can do any of such. But if the patient is grieved and reports you and you have to go to either court or medical tribunal, your case has gone up.
Okay.
And if they find out that you erred, do you understand? Because there's what we call medical jurisprudence. A doctor must practice safely. There's what we call, in our practice, you must bring in justice. You must bring in, there's what we call first and foremost, do no harm. So when we tell you that if you see something you cannot do, please do not try. It's human beings we are talking about. So first and foremost, do no harm. If you now do harm and we find out that you are not at that level to do that kind of procedure, you are going in for it. That is why we have specialties. There's something you will do at your level, you are not supposed to do it. So you are going to go in for it, especially if patient complaints and the tribunal finds out that actually you are not qualified to do what you are doing. You have to go in for it.
Okay.
Yeah. So there are the people, because you can be a victim, I can be a victim.
Of course.
So all these things are there. Only that, in Nigeria, sometimes patients just take it by their strides, is God, and they go away. But places like Abuja now, people are going to court suing doctors anyhow because they feel aggrieved. And that is why we are trying to put these things in place, because medical audit is also beneficial to us. Very important, because we need the patients to also have a kind of trust in where they are coming. And so we don't take it lightly as consultants, because you are training these doctors to be able to deliver accurate care based on evidence-based
Medicine?
Medicine, yes. That is what we practice. So if you go outside evidence-based medicine, you're on your own.
Okay.
Yeah.
Welcome back. We're just about rounding up our discussion with Dr. Oputa, but before we leave, I want us to revisit the story I told you guys from the beginning. Because, Dr. Oputa, there was a statement you made when I said what should have been the hospital management's responsibility to the patient in terms of taking care of her the cost of her treatment when she came back for that mistake. And then you said no, that the patient would have to pay whether the doctor made a mistake or not. But is that fair?
Yeah, well, it's a government hospital. Sometimes we treat indigent patients. Sometimes we treat patients that are poor and they go home. But what we are saying based on principle is that if the people that ruptured that woman's uterus that I said, didn't know they've caused death of the woman. And when the woman came to our hospital, they won't go and catch the people that caused the rupture to come and pay. They caused the complication. If they had done well, the woman wouldn't pay.
How about in the case of my own story, where
in your own story, the woman, if it's a private hospital,
it was a government clinic, actually.
It's a government clinic, yes. So if it's a government hospital, maybe if it's a private clinic, maybe the MD might look away. But I'm telling you that doctors do procedures and complications arise from those procedures.
But in the spirit of, calming down situations, trying to prevent litigations and all that, isn't it fair to say, oh, we're sorry this happened, because of that, we're going to take care of this and take care of that, so everybody's just calm?
No, it depends on who is involved and how they want to settle it. Do you get what I'm just
So
trying to
now,
say?
if she had pressed further, maybe the hospital would have offered that. Is that what you're saying?
If he has pressed further and then has a case,
Yes.
you understand? Maybe, just maybe. But what I want you to take home is that a complication arose from
A
treatment
procedure.
of a doctor or a procedure or a prescription. Doesn't mean that the doctor or the hospital have to pay for that complication. No.
Okay. So
I can give you drug now, and you go and then have side effects to that
I think that's
drug.
a different scenario.
It's not a different
That's
scenario.
drug reaction,
That's
which
drug
you
reaction.
can't control.
Yes.
But we're talking of the one that you forget an object inside someone's body.
Yeah, that's what I'm saying. I just gave you an example of
So-
somebody that wanted to
Because
help
if it's-
and rupture somebody's uterus.
Because if you go to court and then I don't think the hospital will be able to say, oh, it happens, mistakes happen. The hospital is not
No,
required
when you go to court,
take care of the
when you go to court,
costs.
you know what the court will look at. One, what were the costs of the complications that happened to that woman?
Yes.
Maybe
Okay.
just the cost of antibiotics and all that. It never affected the woman. The woman still had all his.
No, she was lucky.
children.
She was lucky. What
So
if she
the case
wasn't
you chose-
lucky?
If he wasn't lucky, then it's
Because
another case.
hundreds of thousands of Nigerians have been unlucky. That's what I'm saying.
That is why medicine, when we want to do surgery, you will tell you to write.
You sign.
Yes, you sign.
No.
Because our aim is not to kill you, but you can enter that theater and never come out.
Okay. All right, fine.
You understand? And then who is to blame? The important thing is that average doctor have gone. Our desire is to give you the best. But if it comes out the other way, we can look into it to know whether it's negligent. But if the doctor in his duty is doing everything normally, even complications can occur.
Okay.
Do you understand? Yes, and the patient can actually die.
Even though I think it's unfair, I think it's unfair actually.
That-
Because if it happens to someone, your sister, your friend, your relative, that the hospital wouldn't take care of the damages. Like it's unfair.
How do you quantify the damages? So the woman would have come, maybe quantify the
No,
damages.
in this case, they should have paid the cost, the hospital, the bills, the antibiotics she took, the bed space, they pay for it, and then they just take care of everything. And then
Everything.
discharge. Yes, that's it. I think it wouldn't have taken them anything to do that. And they maybe just offer an apology, like, and
Yeah,
the doctor
for
that was
apolo-
involved.
For apology.
The doctor that was
for
involved.
apology. We have what we call medical ethics. Medical ethics. Patients are highly protected in this profession. Highly protected. And they're always right. So everything is geared towards protecting the patient rather than protecting healthcare professionals.
Okay.
Do you understand? Except when the patient is just something else. So there's also things that protect the doctor. Because you can't come and you want to hook a doctor, you want to harass a doctor because maybe you brought in an emergency and in the process the person died and then you want to start fighting in the hospital. It's not nice.
Of course.
Okay, but 98% of the time, everything is based for patient comfort, care, and everything is just for the patient.
Patient is king.
The patient is king in the hospital. So every doctor you see is working hard to know better, to do better. And we have, like I said, a system of where more knowledgeable doctors are monitoring the work of less knowledgeable doctors based on the cadre. It's a continuous thing. So there are something you must call your chief to tell him, and then he can come or tell you what to do. So these are the things that are in place. Do you understand?
Okay. Let me ask you about auditing consultants now.
Yeah.
Because we've had situations where stories in hospitals where there are complications and the consultant is nowhere to be found. So it's left to the junior doctors to handle the case. How do we ensure that surgeons, consultants are giving their maximum or the expected maximum or minimum in terms of time? In terms of their time?
Well, you see, when it comes, how do you audit consultants? The consultant is the one that owns the patients
Okay.
in the hospital.
So in the cases where you hear patients say, oh, my dad was, dying, the doctor was trying to get his consultant, couldn't get him on the phone, blah, 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 blah. Those are very popular stories we hear all the time.
Yes. You see, because we have first on call, second on call, and third on call in the hospital. Every day is like that. Now in some hospitals, if you're on call, you come and sleep there, whether you're a consultant, depending on the department. Okay? So first on call is a doctor. Like I used to tell everybody that there's no small snake. Every poisonous snake can kill.
They're usually just a house officer sometimes. A house officer first on call.
Yes, first on call.
Yes,
So they have their
senior range.
Extent, yes, they have extent of what they should see, and they call the senior range. The senior range can be sleeping in his storeroom. You don't call a senior range when somebody just came probably with fever and needs to be tappy sponge and then maybe give him paracetamol injection or tablet and they go home. So first on call will attend to the person first. Now it's now left for first on call to know the indications for referral or to call his boss, the second on call. So these things are there. So if he fails to do that, it's a big problem. If the second on call if you're on call, you must either be available or keep a free line where you can be contacted. Because if the first on call is calling you and you're not responding, you will be held for it.
Okay.
That is it.
Okay.
Do you understand? So everything is like that, and it's documented, and they have all this list clear, pasted. So when something happens, they will trace the people that are supposed to take care of that patient and deal with them appropriately.
All right.
Yes.
Thank you so much, sir.
Thank you.
So, but before we leave, one last question. I ask my guests this question all the time. If today you're made the Minister of Health of Nigeria, the challenges in the health sector, they are numerous. We all know that. What is that one thing, just one, that you're going to do that will have like a positive ripple effect on the other challenges?
Oh!
Yes.
This is a beautiful question. Thank you. I'm a consultant family physician.
Okay.
And also a primary care specialist. Okay? Now, the problem of our country, just like this patient I told you had, was problem of poor manpower in the primary health centers. Do you understand? Our people deserve the best. And then so a PHC needs to employ a doctor. Why that woman died actually is that the system is poor or lacking in employing a capable hand in a PHC. You know, so there's what we call the chronic care model. The chronic care model is lacking. I just came back from Saudi Arabia. You find out that in fact, in their primary healthcare centers, they have adequate manpower. And there are certain things you cannot try to do. A PHC cannot be talking of having deliveries, especially that kind of delivery. If it's not spontaneous, you refer, bundle, there's nothing you are checking. Get to the hospital. Are you getting my point? So the thing I will do is to strengthen our PHCs. And once you strengthen the PHCs and they know what their capacity, then we're off. That's strengthen. If you strengthen the PHC, the country's healthcare will be just superb. Because if a doctor is in the PHC, there will be increased confidence to even attend the PHC.
Yes, absolutely.
Yeah. Absolutely. So no doctor there. So patients don't like going to see nurses and maybe.
So they end up putting so much pressure on the secondary.
Yes, and then some that don't have money to come directly will go and receive the worst care you can imagine.
Okay. Thank you so much, sir.
Thank you very much.
It's been so wonderful having you on the show.
Right,
that's it for us today. Until next time, stay healthy, stay health aware. Bye-bye.